mynews.studio.
Each year, about 7.1 million cancer cases could actually be prevented. The question is, will we use that knowledge to really shift the course of global health?
Today's date is February 10th, 2026. Let's start from the top. Cancer is still one of the main causes of death around the globe. Nearly 10 million people die from it every year. But there's a new World Health Organization study covering 185 countries that says over 1/3 of cancer cases could be avoided by just changing daily habits.
Right. The data spells it out. The study in Nature Medicine highlights 30 different factors we can actually change. The biggest one? Tobacco. It accounts for 15% of new cases worldwide. To put numbers on that, we're talking about 1.8 million lung cancer cases in 2022 from smoking alone. Why is this so critical? Even though smoking in the U.S. dropped by 74% since 1965, it hasn't gone away, especially in groups that are more at risk.
So tobacco's still the main factor, but what else is driving these numbers? Infections like HPV and hepatitis B cause about 10% of cases. Alcohol adds another 3%. Those might sound like small shares, but in places where vaccination rates are low or alcohol use is high, the numbers can climb quickly. Is this where government policies come into play?
Yes, that's where proven prevention steps matter. Smoking bans, HPV vaccines, clear alcohol rules, they all show results. For instance, Korea's seen real drops in cancer risk just by enforcing smoking bans, promoting moderate drinking, and encouraging regular exercise. It's not only about telling people what to do, but making healthy choices part of daily life.
But changing habits isn't always realistic, especially in countries where healthcare is already stretched. How do you put prevention strategies in place when resources are tight?
International help is crucial. Funding HPV and hepatitis B vaccinations, for example, can prevent thousands of cancer cases linked to infections. The Framework Convention on Tobacco Control helps countries roll out anti-smoking policies even with limited budgets. And simple things, like local exercise programs, can be adapted to fit different communities. If a full healthcare overhaul isn't possible, smaller, focused programs can still have an impact.
That brings up another layer. The study points out that women are more vulnerable to cancers linked to obesity and alcohol, like breast cancer. Should public health campaigns look different for men and women?
They should. Programs tailored for women, like nutrition and exercise initiatives, can directly address those risks. For men in Asia, ramping up anti-tobacco efforts is key, and on a regional level, targeted approaches work. Tackling radon exposure in the U.S. or using BMI scoring in Korea shows that policies based on local data are more effective than blanket strategies.
So in practical terms, prevention isn't just a theory, it's possible. The science backs it up, and the track record for these strategies is solid. But why don't we see more urgency from leaders and policymakers?
It comes down to priorities. Prevention doesn't usually make headlines, but this study lays out what's at stake. Millions of preventable cases, reduced healthcare spending, and lives saved. The real question is whether governments, local communities, and individuals will choose to act on this information.
So, to recap, 1/3 of cancer cases can be prevented, with tobacco use, infections, and alcohol as the main targets. Prevention works, everything from vaccines to lifestyle campaigns. We've seen it in countries like Korea and the US. Even with fewer resources, countries can make real progress if they have international backing.
The opportunity is enormous, but responsibility is shared. Patients, policymakers, citizens, we all have a part to play. Imagine a future where far fewer people face a cancer diagnosis each year.
Thank you for tuning in. This episode was brought to you by mynews.studio. You can try it now, free of charge.